Aboriginal and Torres Strait Islander health workers are critical to closing the health gap. They are highly trained and highly skilled, and their clinical and cultural knowledge is vital to their role within hospital teams. Flinders Medical Centre in Adelaide is a major teaching hospital. Within its Kapa Naratendi Aboriginal Health Unit, the hospital liaison officers are all qualified health workers, for whom liaison is only a part of their role. They use their clinical knowledge to improve health literacy of Aboriginal patients and the cultural sensitivity of the mainstream hospital environment.
It's a big thing coming down to a hospital if you've never left your community. So we're called upon a lot in dealing with the patients.
Up on the list is Tani, Archie.
When we come in the mornings, we have a client list which tells us who's in an inpatient, who's coming and who's been in overnight.
We'll go and see Ronald. He's had his procedure yesterday. I'm pretty certain that it was just the angiogram.
Natalie was supposed to have her procedure yesterday, but we hear that she might not have had it.
Okay, I'm going up to see Natalie. Okay. Our job is to look after the Aboriginal patients, but also advocate on their behalf, because Aboriginal people are very shy people. You know, we don't like to look at people, we don't like to talk to non-Indigenous people, especially in a hospital like doctors and nurses. So Aboriginal health workers are very important.
I'm here to see Natalie.
Yeah, she's in bed number 9.
Thank you.
Problem with my heart. Problem with your heart. So did you have that procedure yesterday? No, today.
Today.
When they're in the hospital, then the liaison workers visit them on the wards and then liaise with doctors and nurses about cultural aspects that they might need to think about.
Now you're going to have your angiogram, artery. Okay.
Today.
Okay.
I came down for this.
Yes. Do the angio, maybe put a stent, put the balloon.
Yes.
Yeah.
I was just letting her know what sort of procedure she was having, whether she understood what she was having and whether she was happy about having it.
So after your procedure, you'll go to the hostel with Josette.
Oh, yeah.
And
Health workers will talk with the patients to make sure they understand what the process is going to be, what surgery or procedure they're going to have, how long they're going to be here, what's the process when they leave hospital, how long they have to stay before they can go home, whether we have to arrange accommodation. When they're discharged, then we need to arrange flights home, need to make sure that their medications are available, not just here that they leave with, but the medications are available once they get back to their communities.
on discharge, you'll have your medication, you go to the hostel, and then you'll fly home after 5 days.
After 5 days.
After 5 days, after the stent, yeah.
After the operation.
So you've done really well, Natalie, because I remember you wanted to go home the first day you came here.
We are a support service here and a very important link to the whole journey, because it is a journey for our people coming down from wherever, because you're going interstate, you're in a strange place, in hospital, so you need all the support you can get.
Tomorrow.
Yes, yes. So procedure today, discharge tomorrow. That's how it normally works.
What can I do for you today, Audrey?
I'm just letting you know that Natalie will be discharged today.
So you need accommodation for 2?
Yes. I'm passionate about this job because Aboriginal people die, 17 to 18 years before non-Indigenous people. I just want to make a difference, even if it's a small difference.
Oh, Sebastian's going to the ward today.
So I think they'll keep it one more night, probably when the bed's ready tomorrow.
Well, a lot of the nursing staff, the doctors, their knowledge of Aboriginal culture is limited, so that's where we play that role in educating them a little bit.
Okay.
And a lot of the staff here don't realise that some of these patients coming from their community is their first time leaving their community.
Yeah, I'm JP.
And they come into a big city, a big hospital, and they're seeing a lot of strange faces.
Okay.
And I see those patients coming with a lot of fear, shame, job. They're very scared. They might have had an experience with a relative that might have been in the same hospital previously and they didn't return home. Hey, boss, how you going, all right? Are you going good? So you end up having that thing yesterday, that procedure yesterday. And yeah, just talking to the nurse there now, looking at possibly discharge today. So I'll find you accommodation at one of the Aboriginal hostels And then, yeah, like what I had to do was get Sue, one of the nurses, involved to talk to Ronald about the discharge process. She'll go through the education pack with you and explain everything so you understand what to do from now on to really look after yourself.
After a stent, you'll be on medicines for the rest of your life. Need to take these every day. If you're not taking your medicines, there's a good chance your stent will block up. Aboriginal liaison officers are a great resource as far as cultural learning. We've had them giving in-service sessions to nurses on the ward.
We have a greater role in the training of non-Aboriginal workers in understanding the cultural elements of what you might need to think about as having an Aboriginal patient, hence the need for Aboriginal health workers within hospitals.
If there's any questions that you want to say now. During the talk with Sue, I felt that Ronald was saying yes a lot. A lot of our patients will say yep, 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 and really I know that information's not sinking in. Yeah, yeah. There's a lot of the doctors and medical staff do use the medical jargon. Myself, obviously, I can pick up on it, but a lot of our clients and patients, they don't understand what the doctors and nurses are talking about. Yep. I was able to get Ronald by himself and ask him how he felt after that information was given. Yeah, I think it was a little bit overloaded for him, so he was able to sit down with me and ask me some of the questions that he sort of missed.
Smoking business, smoking for a couple of months.
I can get in touch with a quit smoking worker back in the community and I'll organise for them to set up an appointment. You're going to have a lot more energy. You might be able to pull the boots out and have another kick on the footy field. Yeah, but also, you know, there's an option there if we want. So usually the pharmacist will come to our office and they'll see our patient being discharged. Ronald, I've got Claire down. She's the pharmacist, so she'll be the one that's organising all your discharge medications.
These often help to remind you to take your medications. It has the days of the week on the side there.
I make myself present to make sure that the patient really understands exactly what they have to do with their medications, even once they're returned home, getting it refilled with their local health clinic.
Can you just show to me on there which tablets you would take tonight when you go home? Yep, excellent.
The perception is that we are just aides, assistants, but we are a profession in our own right, and the national registration actually justifies that and gives credence to that, I believe, because now we will be seen as a professional workforce. So I think that's a really important part of it.
In the 6 years working in health now, you know, I've obtained my Allied Health Certificate 3, Primary Health Certificate 3 and Primary Health Certificate 4. Now I'm obviously thinking about the next challenge. That could be the diploma in primary healthcare. There's so much you can learn. You know, you can become a physiotherapist if you want, an audiologist, a dietitian, a podiatrist. If not, you can be an allied health assistant, so you'd work in all of those areas. And best of all, just being an Aboriginal health worker, helping our people.